Hi, I'm Dr. Nicole Vane at Moonlight Beach Dental, and I wanted to talk a bit about what I look for on some of the salivary testing on our patients. Now, we offer salivary testing here in the office, and it's meant to test for the most pathogenic bacteria. Usually there's 5 of the worst ones, which are the red complex ones that correlate to gut issues, cardiac issues, stroke, dementia, Alzheimer's, and a lot of cancers and infertility are correlated specifically with 2 of the worst bugs in the red complex bacteria. But we also want it to look for patients that are looking unhealthy. So I don't typically test someone. If you have great firm pink gums, this isn't a test that we would recommend. But for patients where I'm seeing at a young age, it's patients in her 20s, huge tartar everywhere, all around her teeth. Does she need a deep cleaning? Yeah, any dentist is gonna tell you that. But my concern is what's in this bacteria, and also why at such a young age are you building it up this quickly? So we did a test result before we scheduled her back for a deep cleaning. And it's insane. Literally off the charts on red complex, orange complex, green complex bacteria. So every single one of these markers was off the charts measurable. And this is on someone who is very healthy, and she's also young, a young mother. So what we do on cases like this is come up with a specific formula, but I am astounded how many of these test results are coming back lately off the charts like this. We're gonna need to do a total restart for the patient with their oral microbiome. And it actually is really exciting for me. I wasn't doing this testing a couple years ago. I wasn't able to get these patients all the way through to health and see how we can impact their entire life cycle of their mouth and their health, which is one, when we do the deep cleaning, we're gonna need several antibiotics on some of these patients, especially when their test results are this bad. Then we use laser to kill the bacteria at the bottom of the pocket, and we use ozone. And I also use biofilm removal, which I use a special air abrasion unit where I can deep clean below onto the root surface using special powders like sodium bicarbonate that are really alkaline and help smooth down the enamel and any fine particulate bacteria that's still in the pocket. And then we follow up with the laser and ozone when we're done, so we can really get this tissue tight, firm, and more importantly, healthy, where it's not colonized with these bad bacteria. Once we get the bad bacteria out of the way, then we can help get the good bacteria to grow. So I just wanted to go over how important the salivary testing is here in our office. And if you'd like that done, feel free to come on in to Moonlight Beach Dental.